Chairman, we are now live.
Welcome to this virtual meeting of the Health and Wellbeing Board at the London Borough of Hillingdon, which is being broadcast simultaneously on the Council's YouTube channel. My name is Councillor Jane Palmer and I am Chairman of this board. Before we start, some important online housekeeping for everyone present. Please could we ensure that any mobile phones around us are on silent? Please keep your microphone muted when not speaking and then unmute to speak. An example I did not use earlier. As chairman, I will call on those to speak during the meeting. If I don't see you, I apologise in advance. Please just unmute yourself and at a suitable time come into the meeting. It's just not always possible for me to see everybody who's indicating. In terms of technical meeting control, if any statutory voting board member leaves the virtual meeting partway through for a period of time, for example, a lost connection, I'll continue the meeting unless we are not quorate, which is 5 members. Before I am going to go on to the agenda, I would like to do a roll call of the councillors and others present to confirm attendance. If you could please indicate you are present when I say your name. Councillor Jonathan Bianco.
Present.
Councillor Keith Burrows. Keith did indicate to me that he may be a little bit late. I'm expecting him later. Councillor Richard Lewis.
Present, Chairman.
Councillor Douglas Mills. Councillor Susan O'Brien.
Present.
Dr. Ian Goodman.
Present.
Lynn Hill.
Present.
Tony Zaman.
Present.
Sharon Day.
Present.
Dan Kennedy.
Present.
Robin Doran. Or Graham Cole.
Graham Cole is present.
Thank you. Nick Hunt.
Present.
Thank you. Dr. Kuldeer Johal.
Chairman, Sarah Crowther's here.
I beg your pardon, Sarah. My apologies.
Thanks, Chair.
We also have the following officers that will be attending the meeting. Tina Benson, who I know has to leave at 4, Kevin Byrne, Gary Collier, Amanda Gregory, Joe Newen and Nikki O'Halloran. So thank you all very much. We are going to move on to the agenda. Do we have any apologies, Nikki?
Chairman, we've had apologies from Councillor Saray Puddifoot, from Councillor Cawthorne, from Steve Hadjioff, and Sharon Day is here as his substitute, from Jason Sees, Caroline Morrison, Bob Bell and Nick Hunt is here as his substitute. And I see that Councillor Burrows has attended.
Thank you. Okay, so before I go, yes, I'm going to just do the declarations of interest first. Are there any? I will take it if there are none. I'll just go quiet for a moment. I'm going to take that pause to be a no declaration of interest. We also need to receive and agree the minutes of the meeting of the 22nd of 2020. I will do the same. I will leave a pause, and if there is a suitable pause, I will assume that those amendments are agreed.
Hello.
Okay, so I will take those as agreed. agenda item 4 is the exclusion of the press and public. We do have agenda item part 2. So when that comes, I will ask Nikki to suspend the recording and we will continue. So before we go on to agenda item 5, I just want to firstly apologise for my late appearance on screen and welcome everybody here. We have a full agenda today which covers the latest position regarding COVID pandemic and also the strategic changes underway in the NHS with the move towards the single NWL-CCG and the NWL integrated care system. As I said at the last meeting, it's my intention that we should look to change how this board works so that as a health and care partners, we can lead the change we want to see in Hillingdon. As a small step in that direction, I've once again asked that the authors of the reports present their own work to the board so we can hear directly about the issues and steer what we wish to see happen next. So we have Joan Ewan and Amanda Gregory from HCCG and Gary and Kevin from the council. So we are also going to hear plans for a workshop about rebooting the board. Going through the agenda then in the order, agenda item 5 is the local control outbreak plan, and that's Dan Kennedy. Thank you very much, Dan.
Thank you, Chairman. So you have the report in front of you, providing the second report to the board on our outbreak control plan. This plan being a partnership plan led by the local authority to set out the actions to prevent and contain the spread of the coronavirus. Now, I think it's fair to say that the situation around the virus has been and continues to be fast changing, as we've seen in recent months. And as a nation, we're just about to exit the second national lockdown. And for London, this means that we'll be re-entering tier 2 out of the 3 tiers with restrictions. And we are expecting sort of further restrictions within that to be confirmed, which is being considered by council officers when that arrives. I think it's also important to add that council officers and partners within Hillingdon have continued to work very closely together and at pace at times to implement government requirements and take local action. And if I may just highlight a few points just to bring to your attention, and then I'll move to some questions. But I think I just want to highlight as well that the monitoring of infection rates across the borough happens 7 days a week, and that information is provided to key individuals, and discussion on a daily basis with health partners and other partners around infection rates is taking place, so that we can be as much as we can be the front foot with following up on any issues as they arise. Environmental health officers from the council have visited business premises regularly to provide support to businesses to implement and be compliant with government guidelines, and in a minority of cases we've had to issue fixed penalty notices or fines to some of those businesses to make sure that they do comply. We've continued to work with a range of settings and organisations which can present as slightly higher risk, but also to provide support. So Heathrow Airport Limited, universities, care providers, schools, amongst others. And in particular, care settings, we've worked very closely with care providers to provide advice, guidance, and also quality assurance to keep infection rates as low as possible for very obvious reasons. I suppose some more recent developments include extending testing. So extending, in particular, mass testing or asymptomatic testing is about to happen, and that's been extended across London. So that's quite a big development locally. Track and trace, that was a complementary service to support the NHS that went live in Hillingdon earlier last month. And this is where we make contact with residents locally where the NHS haven't been able to make contact with them, who are at risk of having contracted coronavirus. And the good news is that we're achieving a very high contact rate, which means then that individuals are getting advice to self-isolate or to follow up with a test, which is good, and it also then limits the spread of that virus. Vulnerable residents have continued to receive food and other support, and both the council and health services and other partners locally are working very, very fast on joint communications and making sure that we're using and maximising all of our communication channels in every aspect, and that includes using the GP text service. And as we know, if one receives a text from your GP, then that's a trusted source of communication. But that does include, of course, working closely with the voluntary sector and also engaging with community and faith leaders to make sure that we're getting messages out there in the right way and in the right format to suit those community groups. And I think finally, and we've all heard about it, is preparing for the COVID vaccination. So the vaccination, as I understand it, hasn't been formally approved yet, but nevertheless, with the NHS taking the lead, we're doing what we can to support that locally with sites and other support that may be needed, so that we can be, again, as quick as we can to make those vaccinations as accessible as we possibly can to all of our residents. Thank you, Chairman.
Thank you, Dan. Just before I go to Councillor Bianco, who has asked to speak, I was on a call this morning to the health and wellbeing chairs across London, and there was a lot of discussion about taking COVID out to people in the community. So I was quite impressed to hear that there's quite some what looks like quite good forward planning about taking it into the community and hopefully vaccinating people in the community. If somebody has carers, then they do that as well. I'm sure that is a very good idea. Councillor Bianco, you want to ask a question? Please go ahead.
Thank you, Chairman. It was just, I was going to follow up what Dan has just said. I know we've identified a location in Ruislip and a second location in Useley, I think, as possible vaccination sites, which is good news and means that we are preparing as much as we can. I wanted to know if anyone was able to provide an update in terms of the latest figures of infection in the borough. This report obviously is now a little old, and as Dan said, things are moving very quickly. And this shows the situation at the 12th of November, and obviously we're now the 1st of December. I just wondered if anyone was able to provide a useful update.
I can, Councillor Bianco. So we track the figures on a daily basis. The good news is that we are in decline. London is also falling, so and it moves from day to day, but roughly speaking, I think from memory, London is about 162 individuals per 100,000, and Hillingdon is of the order of about 155, 156. So, and it wasn't that long ago that we were above average, sadly. So it's it's something that obviously we're confident, but we can't obviously be complacent. And the big concern is that obviously with anticipated social mixing come the festive period, that we may see an increase again. So, but let's hope not. Let's hope that it continues to remain lower and continue to fall.
Thank you.
Dr. Goodman.
Yeah, I've got some up-to-date statistics from Naveed, and actually gives us our neighbours as well. So just out of interest, we're actually at 149.9 today. And our neighbours, Harrow is 127.8, Hounslow is 160, Herts is 108, and Bucks is 107. And the other interesting point is that the positivity rate, i.e. the numbers of positive results, has dropped from 10% to 7.4, which means we're out of the red zone into the amber zone for positivity of testing.
That sounds a good news story, as much as it can possibly be. I can't. Are there any more hands raised? I can't see anybody. Dan, could you just talk to us a little bit about how successful the community engagement's gone? Will we be able to call upon the goodwill of our communities to assist with vaccinations?
Yeah, so we've had several meetings with community leaders, which has been good, and it's gone really well actually. And we're not in the traditional sense of having those sort of face-to-face meetings that we would have had this time last year, but through using the technology. But there's been strong engagement, and the important thing is that it's helped us to tailor the messages to deliver to those community groups and to use those community leaders as the important conduit. But the important thing as well, and this links to supporting vaccination, is trying to understand what concerns some individuals may have about vaccinations more generally. And we've heard that there is this sort of anti-vaccination sort of body or group, or there's misinformation that's being provided. And so as part of that process, we're looking to continue to engage with the community leaders and for them to feed back to us, health and the local authority and voluntary sector partners, what their concerns may be, in order that we can then tailor communications to fit that. But it's a way as well to provide information about how to access the vaccine, and also what support may be available to individuals who maybe are a bit worried about having a vaccination.
Thank you very much. Something that came up, I heard the other day, was when we're using these centres, it's an ideal opportunity to publicise other areas of health that residents may be able to access. So that's maybe something that our partners can think about. Dr. Goodman, is that an old hand or is it a new one? It's an old hand. Is there anybody else wishing to speak? I can't see anybody. Councillor Bianco is smiling. Does anybody else want to say anything on this issue at all? Okay, lovely. Thank you very much, Dan. That's a most useful report, and thank you to Dr. Goodman for adding more positive up-to-date figures. We will go on to agenda item 6, which are 19 to 34 on your papers. And for that, I'd like to invite Gary Collier to speak on the report.
Thank you, Chairman, and good afternoon. This report actually brings together two very interrelated delivery plans. The HHCP, or Hillingdon Health and Care Partners Recovery Plan, and the Better Care Fund Delivery Plan. And it was agreed at the last board in September that we would actually try to integrate these plans in recognition of the interrelationship between the two, and also recognising the joint partnership working towards achieving better outcomes for our residents, and also responding to the requirements of the pandemic. So what's been sent to the board, as I say, is the first attempt at actually bringing this together. And I think first the first question to the board actually is really seeking feedback on whether the board whether this actually meets the board's expectations, whether the level, the structure, and the content is in line with what the board actually wants to see. There are a couple of suggestions that I'd actually put forward, which the board may actually wish to consider in terms of, we could actually preface the next report with some high-level messages to start off with, but also some more information around the HHCP and financial dimensions of the contribution of the schemes to meeting the overall financial deficits within the system.
Does anybody have any immediate responses on that? Is nobody going to say anything at all on it? Does anybody want to speak on that at all? Is there anything else you want to say on it, Gary? Bearing in mind answered.
Chairman, it would appear that the board is reasonably happy with the format of this report, so we will continue to deliver the next report along similar lines. Really, the only other point I really wanted to make before seeing whether the board actually had any particular questions that they wanted to raise about the actual content was regarding the 2021 BCF submission. I alluded within the report to the possibility that we may not actually be required to make a submission, and that has actually been confirmed today by NHS England. So all we will need to do is ensure partner sign off of the content. So we will still need to rely on the delegated arrangements that were agreed at the September board, and then we will be required to provide a detailed financial template submission at the end of the financial year. That was really, Chairman, the only other point that I wanted to make, and then happy with colleagues to address any questions that board members may have.
Thank you, Gary. I mean, it is a very, very clear report, and it would appear by people's silence that we are happy to have it in that format. Councillor Burrows, I see you have your hand raised. Please ask a question.
Thank you, Chairman. Gary, on the flu campaign, it states that there are unfortunately no reliable data sources for rates of health and social care staff across the system being vaccinated. Why is that? Because I work for a major acute trust, and we have to keep very strict records of our frontline staff and other staff that are being vaccinated for obvious reasons. And especially within the social care system at the moment, I would have thought this is quite imperative that we should have some form of recording mechanism that we could gauge the uptake amongst this staff cohort.
It is a difficult one, Councillor Burrows, because there is no actual single IT system operating across all social care providers that is picking this up. There is an attempt to do this or to achieve this through a system developed by the NHS called Capacity Tracker, which has been in operation for the whole of this year, particularly in respect of care homes, and that has actually been picking up data around sort of flu vaccinations from care home providers. Unfortunately, there are issues about the reliability of the data that's actually being recorded, because it's only as good as what's inputted, and the system itself is quite clunky. This is actually being expanded to home care providers, and that actually started on Monday. So home care providers will start to input that information, but again, it is not the easiest of systems to use, and there will be an ongoing issue around the reliability of the data.
Thank you. Does that help you, Councillor Burrows?
It does. Thank you, Chairman.
Thank you. Graham Cole.
Thank you, Chair and Councillor Burrows. Just to your point, so from a CNWL point of view, we're currently reporting 83% of our eligible staff from frontline workers having a flu vaccination. We're continuing the campaign, and we're aiming to get as close to the 90% target that the NHS have set. As a trust, we take incredibly seriously, and we do track it very closely, likewise I'm sure you do in your own organisation as well. So we have that information from a health point of view, but appreciate the challenges there might be in the social care market, trying to pull all that into one place.
Thank you. Are there any members of the HHCP who want to comment on this report? Does anybody want to say anything? Dr. Goodman, anybody?
I don't want to comment on it any further. I think it's quite comprehensive. I just wonder in the future whether we should invite Caroline Morrison, who is going to be, who's the incumbent managing director of HHCP, to attend the Health and Wellbeing Board for future meetings.
Yes, I would hope so. That would be my personal view. Obviously, it's up to the board, but that would be most acceptable.
Chairman, I believe Councillor O'Brien might have wanted to speak.
Oh, sorry. Councillor O'Brien, please apologise. I can't see you on the screen. Please go ahead.
Well, that just won't do, Councillor Palmer. You're going to have to put me a bit further up the priorities, aren't you? Sorry, can I just ask one question in connection with discharge to assess pathways explained? So I can clearly read what it's saying on here. My concern will always be what happens to the over 70s, over 80s that are discharged, that they're able to return home, and yet they are still regarded in my mind as vulnerable, especially if they're returning home to nobody. So we've got all of these pathways. I'd still like to see some information on that, because my experience very recently tells me that I'm not sure how that is continuing to work very well. And sorry, I'm not over 80, apologies. It was a neighbour.
Thanks for clearing that up, Councillor O'Brien. Gary, do you want to answer that?
Well, I'll just come in with the response. I mean, for people not actually requiring care, just some support, Age UK is actually heavily involved in the discharge process in providing ongoing support in circumstances that Councillor O'Brien identified, I believe, up to 6 weeks.
That would be their home from hospital scheme.
Yeah, that's correct, Chairman.
Okay. Does anybody else have a hand raised?
Yes, it's Joni. Yeah, hi. Yes, hi. It's Joni in from the CCG. Yeah, so I think there's also individual cases as well, Councillor O'Brien, is that there's Age UK, but we look at different support as well. So someone who's vulnerable, who's going home, we will look at sort of their needs, the carers, or anyone else that we need to put in place. So I know there's 4 pathways from discharge to assess. It's a national pathway, but for anyone who's clinically vulnerable or anyone in that situation, we're looking at sort of their home support networks. So but if there's any issues that you do have, I'm happy to kind of pick up on the individual cases as well and come back. And it's something that we can address as part of the learning. Thank you.
Thank you very much. Does anybody else wish to speak on this particular issue? Tony Simon, please go ahead.
Thank you, Chairman. Sorry, I'm having to waggle my finger at the screen.
No, please do.
All of the functionality on my system doesn't appear to be working. I just wanted to say, in part linked to what Dr. Goodman was saying, that I think it's worth saying, given that there wasn't much commentary about it when Gary had presented it, that the huge amount of work that sits under this, that Gary kindly pulls together for the organisations in the borough, is something that puts us in a really good position in relation to the changes that are about to come across the health and care system. So Hillingdon was ahead of the game in terms of the early days of accountable care partnerships, which are now the sort of ICP locally. And we've all worked together, aligned our activity, and we're in a really good place to move forward from next April, when the changes have their day one. And in relation to Dr. Goodman's point, one of those changes is, of course, that HHCP will be the entity for the providers in the borough And although the local authority isn't a signatory, will be closely aligned to the activity there and will be a part of the delivery board. And so having Caroline at the board is something that does require consideration, because that will give almost like the system provider overview, which I think will be quite critical, because we'll be less concerned. I know each organisation will be concerned in its own right, but as a board, we'll be less concerned about each individual organisation and more about the collective outcome of those organisations working together, which is what Caroline would be able to articulate for us.
Thank you. Yes, I think the silence. I just want to reiterate that it is an excellent report, and also this board, I hope, would not want to lose Caroline Morrison from speaking on it, because she has been is very knowledgeable about our borough and has always worked exceptionally well in partnership. So I would really hope that that's something that we could continue. Anybody else want any comments, please, or want to say? Yes, please, go ahead.
So 3 very quick points to completely back everything that Tony has just said, and that would really welcome Caroline's future input into the board. As an HHCP member, because you asked the question specifically, I just wanted to congratulate Gary on pulling this report together, because I'm sure it is no mean feat. What I would personally find helpful is just a little call out, because I think this is a brilliant summary of everything that's going on, but if we could point to areas that we're worried about, or things that we think the collective brain power from this board could maybe help try and resolve, that would be helpful. And Councillor O'Brien, on the discharge piece, that there's a lot of work that happens across Hillingdon in coordinating discharge from a strategic point of view, as well as the discharge assess model, and maybe for a future board, we would be happy to coordinate a summary of some of that work, just so that you can see what's happening and clearly provide some challenge into that as well, if that's something that the board would welcome.
Thank you very much. And I think when we come to discuss at some stage the board going forward, the way we present reports are something that is very important to be looking at, because we do need to see areas of success and things we need to look at again. Unless there's anybody that else wants to comment on this, I will take it that the recommendations in the report are carried, unless the voting members state otherwise. I will just leave it for a few seconds. That would appear that is okay. So thank you very, very much indeed. Thank you, Gary. Thank you, Tony.
Chairman.
Spoken on that issue, which brings us on to agenda item 7. Excuse me while I turn my papers. That is the health and wellbeing strategy. I think that's Kevin Byrne.
Yes, thank you, Chairman. Good afternoon, everybody. Can you just hear me all right? Can I check that? Yeah, a few nods, great, good stuff. Okay, so developing Hillingdon's Health and Wellbeing Board, this board, and leading into the Health and Wellbeing Strategy from 2021. At the last meeting of the board, I think we had pretty much full support to look at developing a workshop, given the current opportunities we have around the sort of change that is afoot in the NHS and the council, and the given the current crisis, so that the board could develop its leadership and place role. So at paragraph 3.3 on page 36, I've set out a number of objectives that we might wish to take for this work, looking at what the vision will be moving forward, agreeing among partners how the board can be meaningful for you, and integrated into your own strategic thinking, so that there is something in this for you, looking at our priorities for the future, and then how the board might wish to work. And we've already touched on some of those points already today. And the proposal, therefore, is to hold we would suggest a 3-hour workshop, probably organised for around February 21, next year. We can use the good services of the Local Government Association, who are up for this, to facilitate They are funded by the Department of Health and Social Care to undertake this kind of support and have done it elsewhere. But what is on offer is very much bespoke to Hillingdon. So this is the chance to shape and mould whatever we want to do next, how it best suits the board. The LGA are considering who they will offer up as a facilitator, and they're looking at some names which we'll hear from them shortly. It will be our decision. They have a panel which we can sort of choose from. And what we would look to do is use the time between now and February to obviously firm up an agenda, but include some preparatory interviews with each of the members of the board. And I'll certainly include Caroline on that list, given conversation so far, to capture feedback and look at ideas so that we can hit the ground running at that board, at that meeting. So really, we're inviting any comments or reactions you may have, anything particular that you would want to take from all of this. I see Tony is already waiting. Before I go,
Tony has his hand up. I just would like to say, though, before I go to Tony, that you may all be aware that we are in the process at the moment, or the council is electing a new leader, and that will have potential ramifications in who sits where, including my own role. I would hope that wouldn't change, but I have to be honest, it could. But I reiterate my personal commitment to having a board that you will all want to be part of and which you will see as meaningful for your organisations. And whether it's me or somebody else, that is what I will be selling going forward. I don't want to be sitting here just noting papers and scrutinise. We have work to do in our own organisations, and we need to set out a vision for health and social care in Hillingdon. So I would welcome your views, and Tony Zaman, please go ahead.
You're on mute, Tony.
I realised that just then. Thank you. Thank you, Chairman. And with your grace, I'll reflect on a part of the conversation that we had. I'll keep an eye on your face in case it's telling me to shut up. We just really for other members of the board and HHCP, the conversation that we've had is about whether this environment has provided one which enables you to see it as a part of your kind of governance and the partnership arrangements with us. And the chairman and I were discussing this at some length and coming to the view that the whole point of the development session that we were having, because everybody can sort of groan when they hear those words and think, oh boy, I'm going to be sitting through 3 hours of navel gazing or something. But the point is a good one, which is we want to create an environment where we can bring the challenging issues to the table rather more than we just bring papers that are agreed or noted or something else, because and some of the questions that have been raised about, for example, hospital discharges just now, there's a really good example of where we can have some of those challenging discussions and where people feel safe and that it's appropriate to do so. So I just wanted to reflect some of the background conversation to the paper that Kevin's presented in a slightly more sort of blunt way, I suppose, because it's so do try and sort of embrace the point and see it see the spirit that it's been designed in, which is to create the environment where you as partners feel that you're contributing as fully as you should be, and you'll all be aware of how different sort of health and wellbeing boards are. And that's not to say that ours is wrong or has been bad, but going forward, we just want to make it functional for everybody. Thank you, Chairman.
And you can see there, Tony, my face is very happy and smiling. I think the spirit of the board is exactly what I'm trying to achieve here. And I have also spoken with Dr. Goodman on the same subject, and I would like to think that we are both focused in making this as amenable and useful and a happy place to be, rather than, oh my goodness, I've got a health and wellbeing board meeting, which is not my style at all. Does anybody wish to comment? I would be grateful for comments, because Councillor O'Brien, there you are in the bottom right hand corner, please go ahead.
Thank you, and thank you, Chairman. And Tony, loving the words enabling governance we have so many items that we can try and work with. Kevin very kindly puts our public health priorities in 3.9. There is so much here that I would love to be able to literally tackle. And I really welcome coming to a meeting, a board that's going to empower us and engage us and allow us to be able to tick things off the list. I'm delighted to move forwards with this and delighted to do the training and looking forward to how we are going to move forwards with this. Same position as Councillor Palmer. I'd love to be here at the next one in March, and I hope very much that that whoever does move forwards with this, it picks it up with the same amount of vigour that I'm prepared to do. Thank you.
Thank you. Joe Newen, please.
Yep, I just want to say on behalf, I guess, working with HHCP partners as well, I think the Health and Wellbeing Board is critical as our governance, where we bring all of the work here. So I just wanted just to echo that as well. That and I know, Kevin, you've been working through with HHCP colleagues to make sure that we align this, because I think the agenda is much more wider than just health, and I think we need to bring all of this together. So I just want to echo that, really.
That's lovely, thank you. Anybody else want to either agree or disagree with what we're going to look at? That's a high five, punch the air moment as far as I'm concerned. Then that's really good news to hear that. So I look forward to that developing. I look forward to seeing you all when we come up with a date. And please, I reiterate, we need to be as honest as we possibly can about what we like and what we don't like, because that's the only way there's going to be change. Thank you very, very much, everybody, for that agreement. We're going to go on to agenda item 8, which is the Hillingdon CCG I can't get my teeth in, the update. That's going to be either Ian or Joe or both of you, please.
I'm happy to start, Councillor Palmer.
Thanks, Ian.
And if you want to fill in. So this is quite an abbreviated item, because the finance bit is really been curtailed due to the COVID payment process that's in place. But there are a couple of important things I want to highlight on this. And the first one is about the Northwest London merger of the 8 CCGs, which is part of the NHS long-term plan. So we voted in the end of October. The CCG voted, or the members, perhaps of the CCG, voted to agree to merge with the other 7 CCGs. And that will happen on the 1st of April. And so from the 1st of April, there'll be one large CCG for all the 8 boroughs in Northwest London. And interestingly enough, on Friday, the NHS produced a discussion paper around that process in general, because the NHS, its view is that it wants to see larger CCGs for geographic areas. What used to be called old STP areas are now called ICS areas. So in a way, we're ahead of the curve there. There are some other areas that the paper discusses around finance, and it's probably worth bringing back to the next meeting when the feedback from that paper has come out. What that means is that also there's been a reorganisation with our staff, and we've had to downsize due to financial constraints. So unfortunately, we are losing key members. So as you've heard, Caroline is moving on, but she's not leaving the borough, but she's becoming the managing director of HHCP. And I think that's only a positive thing. Unfortunately, we're losing Joni Iron, who is going to be the borough lead in Westminster, central London. And we're all sad to see him go, but we have 2 very experienced managers coming in to take his place. Sue Jeffers and Richard Ellis, who start, I think, next week. And they've been around North West London NHS for the other issue is that we won't have a overall managing director or a accountable officer for a single CCG. Instead, Brent, Harrow and Hillingdon will have a joint operating officer, and we'll also have some joint operating directories, particularly finance, will be working together. So that's just a consequence of the review and would have happened whether we'd have voted for one CCG or stayed alone. You've heard about the COVID response already from Dan. There's not much more to add to that. In terms of the flu programme, that's still going ahead. The latest figures I've got on that for Hillingdon are that for the over 65s, we're at 70.5% vaccinated, and in care homes we're 70% vaccinated. So we're doing quite well there. We're ahead of where we were last year. We've still got a lot to do in the at-risk under 65s, and we've started vaccinating the everybody from 50 to 65 at the moment. The vaccine's been made available for that. In terms of winter planning, as you've heard, that there's pressure on beds, as there always is this time of year. Fortunately, the incidence of COVID seems to be in decline due to the lockdown measures, but the non-COVID admissions are still quite high, and so the occupancy rates in hospital is causing some pressure, which is compounded by the fact that the hospital has to keep its COVID patients away from its non-COVID patients to avoid cross-contamination. So the paper describes 3 areas where we've concentrated to keeping the down in the hospital, and there's a lot of collaborative work going on that's been very successful in improving the discharge rate from the hospitals. And finally, onto the finance. In a way, it's rather an academic exercise, as I alluded to earlier on, because the contracts for this year, because of COVID, are all blocked off, so that the hospital will get funding on a block contract basis, and the CCG will be paid on a similar way. So we're not seeing any deficits, any new deficits at the moment, only historic deficits that we have to work to. So that's a rundown of what's happening in the CCG. I'm happy to take. Joe may want to add anything I've said.
Okay, thank you. Joe, did you want to add anything?
No, that was an excellent summary, Ian. Thank you.
Thank you very much. Before I go on to questions, Joe, I just want to wish you all the best in Westminster, and best of luck going forward. It's their gain is our loss, so very, very good wishes to you. So I have at least 3 people wishing to speak. Councillor Bianco, you were first.
Thank you, Chairman. I did see Tony Zaman waving his hand. I didn't know if he had some relevant point to make before I ask a question.
No pressure there, Chairman. Councillor Bianco, thank you. To be sort of interesting and relevant, but I just wanted to add, and I thought it sort of worth adding. Councillor Palmer will already know this, that I think it's worth the board members knowing, and what I'm saying is no reflection of NHS colleagues around the table, but we had some pretty old-fashioned views about the changes that were being brought about by the starting point being the NHS long-term plan in relation to the CCGs, because we have worked really well with the local CCG, Ian, Caroline, Joe, others, and with our local providers, CNWL, THH, etc. And the arrangements that are being put in place, we made very strong representations, and Councillor Palmer, along with myself and the Chief Executive, made those representations in writing, that there is, because of the congruence of this borough in relation to the residents, the patients that utilise the hospital and the community health services, roughly, it's about 85% congruence. All people use the facilities in the borough, whereas others have many more complicated flows of patients between boroughs to different hospitals and so on. And so we made a case to say that actually Hillingdon should be slightly different rather than being one shared amongst sort of many others. We've also made, I just want to let the board know that we've also made very strong representations about the lack of local government inclusion in processes in relation to decisions about personnel. And now, as it happens, we've been fortunate that Caroline's been secured here, because I think, from a local government perspective, we'd have been strong supporters of that as the outcome. But there are several others that we're less than happy about, because we simply weren't involved in those processes. So now, to some degree, we're where we are, and we have to make the most of it going forward. But right up until the end of last week, the Chief Executive, Fran, and I had conversations with Leslie Watts, who's the ICS, I think Chief Executive, Ian is the correct language, and shared our frustrations about the processes and the lack of involvement of local government. So it's not been straightforward, it's not been easy, and I think there is still a case that Hillingdon should have been treated slightly differently given its level of congruence. And so it's less to support what Ian was saying, but just to add some backdrop for other members of the board to know that it's not something that's gone as straightforward as it could have done with local authorities, as far as local authority is concerned, because of the lack of involvement. Thank you, Chairman.
Thank you. Councillor Bianco, now it's you.
Thank you, Chairman. It was really a question to Dr. Goodman. He talked about the merging of the CCGs into a sort of a group of 8, I think he said. So West London, I assume. I was just going to ask his opinion in terms of whether bigger is better or not, and whether there were issues he thinks we should look out for going forward, now that it is somewhat going to be a somewhat larger, possibly arguably a less wieldy organisation.
Can I? What you're seeing is, I always, rather tongue-in-cheek, you're seeing in action the way that the NHS is the last vestige of Soviet-style economy in the Western area, with its command and control processes, 5-year plans, and its bigger is better philosophy. Do I think this is better? I mean, I've been around the NHS now for almost 40 years, and it goes in cycles. And this is something I've seen before, moving to a bigger set of management structures. And I have no doubt in my mind this will be a short-term thing as well. I personally don't think bigger is better in NHS. I think it's better to have local-based management organisation. You get better relationships, you get better responses. And I have said that publicly, but the NHS is a juggernaut that goes on in its own way.
Thank you. I am suitably depressed by what you've said.
Dr. Goodman's honesty is always very welcome on this board. Councillor Burrows.
Thank you, Chairman. I just want to come back to the flu programme, because obviously this year it is being pushed very, very hard for obvious reasons. With COVID-19 around, we really want the uptake on the flu programme to be as high as possible. And I can see that we're going for a 75% by the end of November. But it's alluded to in here, what I've heard from some GP surgeries, that because when the flu vaccinations became available, there was this rush to get the vaccination, which was brilliant, but it did cause some GP surgeries to end up with very low stock or no stock for certain age groups. Have we managed to rectify that now so that we can continue going forward and hopefully meet that 75%?
Yeah. Sorry, Ian, did you want to answer the GP question? And I'm happy to answer
Yes, what happened at the beginning was there was a rush, and in fact, the chemists always get their stock first and vaccinated quite a few of the early ones. The way the stock comes into general practice is in a staged way, and some practices did not get their stock until the end of September, beginning middle of October, and started quite late. And also stocks of children's vaccine was also in short supply to start off with. But now all the stocks are available, and there's a straightforward process for practices to acquire additional stock if they want to. My own thoughts are that we've lost a bit of momentum now. We started very well in September, October, but I think energy is lagging amongst the public, and I think they're moving their focus to the COVID vaccine, which may be a bit premature.
Thank you very much. I can't see any more hands raised. In which case...
Sorry, Councillor Palmer, I just want to say, just to answer that as well.
Apologies.
Yeah, no, it's fine. Yeah, so the 75% is very much around all of the at-risk groups. So we've got, I think, in terms of 65 plus in care homes, I think we're in good stead. We're almost there. I think we've got a bit of a plan that we've got to do around expectant mothers at the moment, and the 2 to 3s, which we're working very much with our children's colleague in the schools, where we can sort of tackle that gap. But as Ian says, I think we're starting to get the vaccines through, so it's really just a push on our end.
Thank you, Matt. Sorry, I forgot you wanted to speak there. Please accept my apologies a second time. So I think then we can it just leaves me to say that we look forward to meeting the new people that are going to be appointed in the near future. Pleased to see Caroline will still be continuing, and once again, very best wishes to you, Jo, going forward. Thank you, Dr. Goodman, for the report. We go on to agenda item 9, which is the Hillingdon Hospitals Trust key development. I think we have Tina Benson, who would I would like to something wrong with my teeth this afternoon. I can only apologise. Tina, would you like to present the report?
Chairman, it doesn't look like Tina's actually on the meeting.
Ah, oops.
Would you like to move on to the next agenda item and then come back to this if she joins?
Should she come? Should you notice her coming back in, Nikki? Perhaps you just alert me to that. Otherwise, we'll go on to agenda item 10, which is the mental health service delivery in Hillingdon. Graham Cole, please.
Thanks very much, Chairman. So this report is for information only. I'm sure you've all had an opportunity to read it, but really, the context that we're working in is the NHS launched a 5-year forward view for mental health, and followed by the long-term plan, which set out some quite significant priorities for mental health services, actually led by our own Trust Chief Executive, who's also the national lead for mental health in the NHS. And really the 5-year forward view is about trying to increase access into mental health services, and trying to make sure we're reaching more people as early as possible. We're investing in crisis and trying to avoid unnecessary stays in hospital. And as part of our own trust transformation, we've been looking at our service offer in Hillingdon and making sure we're investing where we can to meet the criteria that's laid out in the long-term plan, and provide the best services we can for the residents of Hillingdon. So just to give you a flavour of some of the work that we have been doing, we've now recently launched a first responders service, and this is a group of clinicians, a bit like a community rapid response team that you may be aware of from a physical healthcare point of view, that can go out and assess patients over a 24-hour period with a view to getting an urgent package of care and being able to keep them home if it's safe to do so, rather than have them attend normally via A&E and then being admitted into an acute mental health ward. We've also been looking at our early help offer. So we've developed the Cove, which is a crisis response in Hillingdon. It's actually based in Hayes Community Centre. It now operates between 2:30 and 9:30, 7 days a week. And we can, if an individual is either referred via GP or contacts our single point of access, we can refer them there for immediate support. And working with some non-qualified staff, but people that will be able to provide access to instant help and information, and again trying to avoid unnecessary stays in hospital. We've also been looking at how we can enhance our acute offer, and we're rolling out a package called See, Think, Act, which really increases the therapeutic input into the wards that we have in Hillingdon, and really focuses on the emotional needs of patients, again, to try and make it as therapeutic as possible. And the more therapeutic intervention we can load up front, the shorter the stay will hopefully be in hospital. And we're also enhancing our support for people with complex emotional needs or personality disorders, and putting more investment into our home treatment teams, which are helping people come out of hospital early and stay at home then with a package of care. Moving forward, our focus is going to be on the 0 to 25 pathway, and a lot of that is about getting early help and having services that are specifically targeted at the sort of 16 to 25 year olds who have a slightly different need because of that transition from being a young person into a young adult. And we already have some services in that area, but we're looking to expand that offer. We're also looking at our neurodevelopmental pathway, so the 0 to 5s, and seeing what further mental health input we can put in that agenda. And we're rolling out a crisis helpline across the trust, which will be an all-adult service, but specifically for our young people. We're looking at how we can signpost into crisis services and get early help from the right source, rather than people feeling they have to go into a mental health specialist service for the crisis intervention at that time. You'll also be aware that in Hillingdon, we've been having discussions with the local authority about our relationship through the Section 75, and that's meant that we are changing basically some of our estates provision in the borough. So we're moving our CMHTs, our community mental health teams, into a new site, which will be in the centre of the borough in Mill House. And we're utilising some of our other estate across the borough to provide much more outreach and basically care closer to home where we can do. So we'll do much more group work in community assets and bringing services as close to our residents as possible. And I think in summary, that takes you through the broad, gives you a sense of some of the work that's going on. I should say that a lot of this work is clearly very closely aligned to HHCP, and clearly we want to put as much care, support and expertise into the primary care front end of services, and we're looking at our how we can support the primary care networks and develop our mental health primary care services. So as I started, if we put more expertise and support at the front end of the pathway, then all our work is about early intervention, access and support, which will hopefully reduce people going into crisis and needing acute stays. And I'll pause there and take any questions.
Thank you. I mean, we're grateful for the update there. I mean, it is, I know that mental health services are always under pressure, but they're more under pressure due to COVID. So it's good to hear that, how there's a response, and I'm sure that people aren't going to be arguing with anything in the report. My personal view is I perhaps would have liked to have seen some metrics, some measure. I think when I see reports where we talk about things, I would like just to see a little bit more proof, a little bit more justification, because that's how we will convince people that what you're actually doing is a good thing. Mental health is sometimes quite difficult to to quantify in a report. So perhaps going forward, that's maybe something we could look at. And obviously, you know, the board is there to help with that. Does anybody have any questions for Graham? Can't see any hands.
Councillor O'Brien would like to ask a question.
Councillor O'Brien, I can never see you. Just shout and go for it.
I don't know how you just don't have women's intuition, Chairman. You should do. Can I ask, I'm really interested in this new first response service. And how is this accessed? Does it go via 999 or 101, or does it have to go via a hospital referral? Just very interested in how this is going to play out. And it says access to everybody within the community. Is that people at home as well as homeless?
Yeah, absolutely. So as a trust, we have a single point of access that operates 24 hours a day, and that is open to any referrer or indeed member of the local community who wants to get advice and support for their own mental health, or if they feel they're going into crisis. So it could be we get a call from the police. Equally, through that route, we would be getting calls from other health providers, GPs, or residents. And it's that service that will then deploy the first responders. So the first responders, you know, they don't have ambulances, but they do have vehicles. They will then go out and do an assessment in someone's home. If someone is homeless, they will probably have presented in either in a police station or in another health-based setting. And you know, our first responders go into Hillingdon Hospital and do assessments for patients who are in there. They're in our own health-based place of safety. So it's a, you know, I think of them a bit like a paramedic, and that's the setup really, and the access is through our single point of access.
So that's a really good point there, and it would be quite good to see how successful that has been in terms of facts and figures and feedback from people experiencing it. Anybody else have any issues?
So,
Thanks.
Councillor Palmer, if I could just on your point,
Sure.
Just to get a sense of the activity and demand at the minute. So I just did a very quick piece of work with our team, looking at where we are this year compared to this time last year, to get a sense of what COVID has and how it's impacted our services. So just very, very quickly, our mental health crisis teams, compared to this time last year, are seeing 20% more appointments than they had been. Our liaison services are the services in hospital that support people who are acutely unwell, but also have a potentially an underlying mental health condition. We're seeing a 13% increase in activity. And our community hubs, again, are seeing 13% increases in activity. But what we're also noting is that compared to this time last year, we're seeing a reduction of about 11% in our inpatient admissions. That's not to say there aren't people going into crisis. What it's telling us is all this work we're doing to front end our services is starting to have an impact on the flow into our acute beds, and that's absolutely what the long-term plan is about. So we are starting to see some of the impact coming through now, if that's helpful. But certainly we're happy to come back with other metrics at a future meeting.
Thank you, that's very, very useful. And once again, I am aware that there's some excellent work going on, and anything I say is not ever a criticism of a work. It's just let's prove it, and let's sing the praises of this borough that works excellently, both across voluntary, statutory, clinical, whatever. Lovely. So I think we can bring that agenda item to a close, hopefully, and I'm going to take agenda item.
Chairman, before you move on, just to update you, I've had a message from Tina Benson to advise that she's struggling to get onto the call. Her firewall's actually blocking her from accessing, so she's not going to be able to join the meeting today.
That's a great shame. I feel her pain. We will move on to agenda item 11, which is the children's and young people's mental health and emotional wellbeing. I think that's Joe Newen.
Yes, it's
feedback somewhere. Can we make sure we've got our mics off, please?
Great, thanks, Councillor Palmer. And yeah, just to give everyone a big, just first and foremost, an apologies for not having this on the last agenda item as well. So hopefully we've got a bit of an update this time. Just to give everyone a bit of a recap, I think the way that we used to present this was around the CAMS sort of piece, but I just wanted to kind of just give the board a little bit of a background in terms of how we've progressed over the last sort of 18 months. So back in 2018 and 19, I think the CCG leading on this with health partners, but also working with the local authority, I think, and the third sector, we realized actually we were very much focused on sort of CAMS, but more at crisis point, if you will. And I think there was a huge recognition that we needed to kind of change this model. And what we did back in 2018-19 was that we worked together to bid for some support for the P3 health navigator work, which you're seeing here, which is a very good hands-on sort of service that we've got with P3, working with the two different cohorts between 13 and 18, and also 19 to 25. Our strategy very much in the borough now is very much looking at the not to 25 across children and young people around both physical and mental well-being. I think there's been a lot of updates around COOTH as well, which is the digital sort of support, which I think we've updated in the past. And what we've done sort of at the beginning of COVID, if you will, is that we started prototyping what we called an early intervention offer. And I know that Graham had mentioned this in the mental health sort of update, but also it was also mentioned in Gary's update as well. So hopefully you can start seeing the integrated working that we're doing. What the prototype did was that we just thought actually, there's a lot of different access in terms of emotional well-being. And what we did was we got together all of our partners in CAMS, the PCNs, the primary care, P3, and the MASH service as well. What we did was we started prototyping and sort of an early intervention. I hate to call it a front door, if you will, because it's not a front door, but it's just a place for us to be able to, if it's an issue that professionals had to bring together or they want to raise, but also very similar to what Graham said, it is a service that can be accessed directly through young people through different avenues. So what was quite interesting from that was that we ended up running this in terms of phase 1 and phase 2. First, we focused on the south of the borough, which is where most of our young people sort of live. And then we've expanded it out. And what was really quite interesting from that, and you can see from the stats on page 58, is that out of the 142 referrals that we got in, only 32 of those referrals went to sort of CAMS, if you will, statutory CAMS. So we can see actually, more than sort of 2/3, of the needs is actually not a statutory, not actually mental health. It's actually around support, around emotional well-being, and just life support, really. And I've been in a lot of the sessions as well with young people and going to schools as well. I mean, there's a lot of things that we are talking about that is CAMS is not actually CAMS. It's challenges of COVID, challenges of being a young person, and challenges of employment as well. So it's very much that model that we're trying to get towards. So I think the report really shows just a little bit about how that's kind of worked out in terms of those referrals. And Councillor Palmer, I've noted that we need to start looking at outcomes as well. I think a lot of these numbers in here are inputs, if you will. But I think it does shine a bit of a light in terms of actually where the needs are and where we're actually starting to identify that. Sorry to go backwards and forwards in the paper. So what the team has decided to do is to propose for phase 3 that we better formalize this offer around sort of a clearer front door and making sure that actually we've got all of the sort of information governance in place for different partner agencies to work together. And so that's the proposal that we have put forward on this paper, which we're asking the board to endorse for us to move forward, working with different agencies and different partners across the borough, which we've got there. A bit of the report also just talks a little bit around some of the work, some of the activity and some of the demand around Couth, which is our online sort of offer, which has increased, I think almost, if I'm reading this properly, it's really increased about 50% over COVID, but let me just get back to those numbers. We also have a short piece on CAM services as well. And as you can see, there was a bit of a dip just before we got into sort of COVID, but we are now sort of recovering in terms of that 18 weeks referral to treatment, which is good. But we're also now complementing that with all of the additional support in terms of early intervention as well. And there's a bit more around the Hillingdon Navigator Plus support, the P3, which is part of our sort of partnership. And there's an evaluation report, which I won't go through. So, I mean, that's the overview of the paper. I think General, as one of the lead partners on this, I think this agenda is going very well. I think it's got a very good grassroots sort of buy-in. I think talking to a lot of the practitioners and the clinicians across the partnerships, I think it's been very sort of people have felt that the prototype approach that we've been taking has been quite good, and I think there's been a lot of buy-in in terms of practitioners and clinicians. So it's one of those things where I feel like we haven't really had to incentivize people through money, but actually I think everyone's seen that it's been a helpful way to work together. So I guess from the board, what we're asking is just in terms of the feedback, in terms of the progress, that the board endorses our sort of future direction in terms of formalizing this way of working across the agencies. And then the third one really is just any feedback on the performance around this area.
Thank you. I mean, it's good to see that things look like they're improving. I'm a very big fan of Couth. I think that's a shining example of how to reach out to young people and their mental health. And I first saw that when I chaired the POC, and I've gone on to see how that has developed. So I'm a very, very big fan of Couth. Are you funded for it? I'm sure I'm just not clear altogether about the funding for this. Is it continuing? At times it looks like it's ending in December, January.
Yeah, so in terms of the funding, there's a couple of streams of funding for this. The CCG continues to invest in the mental health investment standards, as Graham knows, so that a lot of the services, so Couth and all that, will continue. What the CCG has done is the governing body has approved for this prototype to continue on into the rest of the year to help facilitate that prototyping and that work. So that continues. The Couth funding continues. We're also looking at other different offers, such as Helios as well, which is looking more around families as well, and things that we can be doing. So I think for us, it's about so the funding is continuing.
Thank you. And at risk of nabbing all the questions, could you just explain a little bit about how the P3 Navigator works, sitting alongside the early intervention model? Is it a different work stream or is it the same? Yeah,
so what it was I think, Kevin, I think this is 1.5 years ago where we jointly worked with P3 to put the funding together. So this is funding that we have from Public Health England, but also it's funded by the CCG as well. So it was always off of, it's very much, it's third sector led, and it's based out of the Useley Centre. So it works with the early intervention offer, but it's just another way for young people to access. So it provides education support, relationships, school. So it's a very sort of open offer, and employment as well. And it provides even links into sort of sexual health as well. So it's just, I think for us, it's just another avenue, if you will, like another offer for young people to go to. That's not sort of, a health service or a social care service.
Sure, I think they need as many avenues as possible. Does anybody have any questions for Joe? Susan O'Brien, Councillor O'Brien, nice to see you.
Nice to see you too. Thank you, Chairman. And Joe, thank you. I've just got a couple of questions, if you don't mind. Just as Councillor Palmer was mentioning about funding, page 57, para 3 talks about the child wellbeing practitioner funding ending in January 21, and then we will lose our early help and prevention offer. So you've said that that the investment is still good and we're looking for others. Will this be a big effect on what we have going forwards?
Yeah. Sorry, I'm just trying to find that. Which page was that on? 57,
Yeah,
you said?
Page 57, and it's paragraph 3.
Right.
Yeah. Yeah, gotcha. So I think this one we are picking up with CNWL. So let me come back to that one, because that's one of the... I don't think that it should be ending, but I think because of the timing of this paper as well. But what I'll do is I'll work with Graham and his team as well, because there's been some additional CYP funding that's been put through by NHS England. So I'll come back to you on that.
Yeah, I'd be grateful for some clarification on that. Thank you. Graham Cole, you have your hand raised.
Yeah.
Oh, I just had another couple of questions, sorry.
Oh, apologies to Councillor O'Brien.
Yeah.
Let me go to Graham first and I'll come back to you. Graham.
So I just wanted to welcome the paper and thank Joe and team for the work that they've done in integrating this pathway. And certainly we really welcome the investment and the work in the early intervention and support and the joint working we have with all partners in Hillingdon, including the local authority on it. The only thing I would call out is, and I think, as you pointed out, Joe, when we look at the CAM's performance on 18 weeks, which is on page 60, I think that gives an indication of the fragility of the team we have for specialist input and support in CAM. So if I was to benchmark, and this is just a fact, I'm not making any other point in fact, but benchmarking our Hillingdon team against some of the other CAM's teams, it's small and therefore it is fragile. So we are clearly doing as much as we can to increase productivity and make sure we're driving as much activity through that team as we can. But I don't think the investment in upfront care can be done at the expense of the investment we have in our core CAM services. We need to protect that and work as hard as we can, whilst we're simultaneously trying to stop people getting to that level of need the crisis support.
Yes. I mean, I just wanted to add into that. So I think in the last 2 years as well, I think we have been investing more to the core CAM services. And I think we may have to look at a benchmarking across that as well. But I do think that the CCG and the governing body has increased sort of additional sort of investment in all areas around early intervention as well. I do also think that a lot of this work as well is around how we use the joint resources together as well, and how we better work together rather than creating little silos of different services that are not sort of necessarily accessible sort of to young people.
Thank you. Councillor O'Brien.
Thank you very much. Thanks, Graham and Joe, for establishing a little bit more of what I was going to ask. Again, I think I'm quite happy with this report. It's very pleasing to actually read, and it's nice to be able to say that that how you're intending to move forward, your 4 key ways. You were talking about a front door. I think accessibility is so important to young people, as well as not only the school age group, but the 17 to 25s. It made very clear in here that because you're 18, you're still a young person, and one day you flip from one to the other. It just doesn't make sense. And that whole integration, we're all getting older, and it's important that we have that continuity as we run through. It'd be lovely if we had the money for everybody for all of the time. I wanted to just ask again, really happy with the report itself, and also the full report on Hillingdon Navigator Plus evaluation. The recommendations are looking good, so it looks as if the project itself is moving forwards, something that we've needed for absolutely years. So full support that if we can continue to have this working well within schools and having that accessibility via, you know, other platforms, i.e. Couth, and I really just welcome this. Fundamentally, we've known for a very long time that we have to be able to help our young people, and it doesn't have to be in crisis. You're absolutely right. It can also just be trying to get them through the day sometimes. So thank you very much.
Kevin,
sorry, I've just realised I forgot the question. Sorry, the question that I wanted to say to you was that apologies,
Councillor Brian, I've got someone waiting.
Yeah, sorry. So the question is then, with the changes in the CCG, and obviously we clearly want this local leadership to retain with us. How do we see that though, overseeing over CAMHS itself?
So what's really good is that we've actually now established CYP not to 25 as one of the 5 clear sort of program areas within HHCP, and it's basically in the last 4 months we've now transitioned this work into the HHCP working as well, and also working with local authority colleagues as well on this in P3. So I envisage this to continue with this work, and actually it'll be much more aligned with the neighbourhood work, but also with the adult mental health and LD work as well. So that's the transition that we're making, and hopefully with the governance in place, we'll just be continuing this work and building on it.
Thank you. Kevin Byrne.
I was ready to come back to the next agenda item, Chairman, if you're ready, but I'm not sure if you finished on Joe's item first, that was all.
Are you pushing me along there, Kevin? Yes, I think we have finished. I think we have finished.
I inadvertently pressed the button because I was at the starting box for the next item. Apologies.
Okay, let me finish this item. So I think thank you very much, Joe. I think unless the board disagree with me, I think we are endorsing the future direction, and you heard what I said. I'd like to see some very good examples of how this is working, showcase the work that Councillor O'Brien correctly says is long overdue. Which brings us on now, finally, Kevin Byrne, to the next agenda item, which is the child healthy weight update. Please go ahead.
Thank you, Chairman. I'm sorry about that. Okay, so yes, child healthy weight update. We skipped this at the last meeting because we were so preoccupied with trying to deal with the issues around COVID. But I think it's an issue that the board has wanted to have on its agenda for a while now. Prior to COVID, we were reviewing all of our efforts across partners on child healthy weight, because we knew that it represented one of the most significant public health issues really in the borough. The data still tells us that 1 in 5 of our children at reception are overweight or obese, and that rises to broadly 2 in 5 at year 6, so at age 10, and with wide variances across the borough. So it's very much a sort of a red indicator on our public health outcomes, and we were asked by the board to look at this through a small partner group which we put together over a year ago and developed the plan. It is Appendix 8 in your papers, and the actions in that plan talk through some of the things that are going on around partners to try and make a difference in this area through early years, maternity, especially around breastfeeding, physical activity, use of green spaces, work with schools, accessing healthy food, public health and community settings, weight management services, etc. And I think if we're honest, a lot of this has had to pause through the COVID crisis, partly because venues were closed, schools and leisure centres, and some staff early on were redeployed. And we are slowly getting back on track to look again at the actions in this plan and make sure that they are being addressed. But for example, schools, even though they are open, are still sort of reticent to engage with issues, which obviously they need to be risk-based given the COVID pandemic. So extracurricular work, working with families out of schools and running sort of activities after school is very difficult.
but that's even more the case that we need to look at this and see what we can do. We know that our school we would want to work with on the SMILE project, which is mentioned in the papers, are developing a video log, which they will hope will be able to be used to sort of roll out a comparable program to the one we had first designed, and we're almost ready to go before COVID took hold. That will be redeveloped, and we'll be looking to try and see if we can get that mobilised probably before the summer. We would hope for the end of the summer term. And we now know that the National Child Measurement Programme is back up and running. It paused for a while. So what this paper is proposing really is that we get the band back together, reconvene the group in the new year to look again at this action plan, make sure it is up to date regarding all the services that are in there, that we're pressing again to try and deliver on all of the issues that we've identified, because I think we know what the issues are. We just want to make sure we're working together to address them. The other opportunity we do have is that the council is retendering its 0 to 19 contract and other public health contracts, and our intention is to seek various creative and innovative responses based around outcomes and based around families to try and address some of these issues. So we're hopeful that we will come up with new ways of working through that process that will allow us to bring this together even more so. So the request to the board is to note where we're at and to give us the mandate to go away and come back with an update to keep this important area on the agenda.
Thank you. And I think that this, sadly, looking at this report, it is a piece of work that needs to be done, and it's going to cut across so many, children who are overweight. It's going to affect mental health going forward. It's something that we really, really should be looking at, and I'm sure the pandemic will be adding to lack of exercise. So I would endorse that this is something that we really do need to continue looking at, and I'm sure that I have the board's support. I would be very surprised if anyone now raises their hand to say no, but I am prepared to be wrong. Fortunately, in this instance, Graham, am I wrong, or do you wish?
No, Chairman, you're not wrong, and I was going to say you've almost read my mind, because the point I did want to raise, and Kevin, we completely welcome this work, and absolutely we need to kickstart it ASAP. But there have been a number of national studies that have said exactly, Chairman, what you were alluding to. The lack of exercise and poor diet during lockdown 1 has meant that there has been a further increase in weight and poor lifestyle for some of our young people, and we'd welcome a conversation as a system about how we can think about some targeted intervention for those young people and their families to try and reset, while we look at the more universal offer moving forward, because clearly we could be storing up a problem for the future if we don't try and fix it now.
Absolutely, and because I just love outcomes, it's something that I think we can easily show how our work will improve the mental health of children going forward. It's not too difficult for all of us if we put on a few pounds to understand that when we've actually managed to shift that through hard work, we feel much better. So I hope the board endorses this report going forward and this development. That's lovely. I'm going to move on with that. I don't think anyone's going to disagree. Thank you very much. We're going to go on now. Thank you, Kevin, for that. We'll go on now to agenda item 13, which is the strategic estate development. And we have Amanda Gregory, if she's still around, to present that for us. Thank you.
Thank you, Chairman, and good afternoon. So just to give a quick update on the strategic estates and progress, I'm happy to announce that NHS Property Services has made progress with regards to Northwood and Pinner. There have been a number of meetings with the existing tenants and also with their architect to design the new health facility. So both GPs have now signed off on the space in the new health centre, and CNWL is expected to confirm the community space tomorrow, having to go through their internal governance. which means that NHS Property Services can now move forward with developing the outline business case, which will be presented to the CCG in February, and a full planning application will follow. With regards to Uxbridge and West Drayton, Chairman, if people are raising their hands, I don't know if it's questions now, or would you like me to continue giving an update through the overall list?
Would you mind going on, and we'll take questions at the end.
That's fine, thank you. So Uxbridge and West Drayton, so CNWL have presented to the CCG in October an alternative solution to the health centre redevelopment. Obviously, there's been issues with regards to the decant of existing services, both in cost and space. So the option that was presented is about a phased move of services from the existing health centre into Beaufort House. The reason it will need to be phased is because of there's existing lease arrangements with tenants within that site. So the CCG have approved that option in principle, and CNWL will now be working on a business case that will kind of reflect the potential design of Beaufort House and the phasing of that move. And the expectation is we'll see a business case in March for the Uxbridge site. With regards to the Hayes housing zone, conversations are continuing with developers both for the old vinyl factory and the Nestlé site. The old vinyl factory is obviously a little bit more advanced, and we've been in discussions with the interested GP, and there are at the moment weekly meetings with the developer about sort of schedule of accommodation and how that will look. So the district valuer will now need to be appointed so that we can get an indication on the cost, which will then go to the CCG for review. With regards to Useley, the works have been done and were completed to make sort of minor improvements to the existing health centre. The CCG is in discussions with regards to the long-term solution, both with a developer who's interested in building in Useley, but also with the planning department on the options available to the CCG for a long-term solution. So Useley still remains a priority, and we are in active discussions around what options are available. Heathrow Villages, while there has been a pause during COVID with regards to the outreach provision, it's still a key priority for the CCG, and options are still being sought in order to provide that outreach for those villages. Harefield Health Centre. So Section 106 has been allocated to increase clinical space on the ground floor of the health centre. That was paused during COVID, but NHS Property Services have been on site and have been in discussion with the practice. The expectation is those works will be completed by the end of March. And then the improvement grant schemes are continuing. Again, there was a pause in construction, but the practices are continuing with their due diligence and works, and any works are expected to be completed by the end of March. With regards to further funding for next year and onwards, we're still waiting for National to advise what additional funding there is for primary care and their internal improvements.
Thank you, Amanda. That's great. Anybody got any hands raised? Councillor Bianco.
Thank you, Chairman. I suppose I should declare an interest immediately. The Cottage Hospital sits in Northwood Hills ward, of which I'm a member, and obviously it's been a long ongoing saga. I'm pleased that it seems to be making progress. I'm concerned that it's still 2.5 years before it might be opened, which seems rather a long time. The question I had, however, is in relation to the ambulance service who currently use that facility as a base in the north of the borough. And I know from previous conversations I've had directly with LAS over their requirements for a new ambulance base ever since the one in Ruislip closed 15 years ago, whenever it did, that they've struggled, well, because for a long time their requirements were completely unrealistic. But of course they've now found this, they've now been using this base for some considerable time. So my question is has any note been taken of their requirement, or are you simply going to turf them out and leave them to find somewhere else if they can?
No, thank you, Councillor Bianco. Just to let you know, I did make contact with the London Ambulance Service last week to ensure that they have been fully engaged with property services. They have confirmed to me that they have, and that vacating the Northwood and Pinner sites does fit in with their overall London estate strategy. I did ask for, because I think they're consolidating a number of sites, and I did say that obviously it will be a concern for those areas where they are vacating, and maybe that's something that London Ambulance Service can present maybe to the scrutiny committee, their entire London estates plan. But I did want to check that NHS Property Services had been fully engaging with them, and they confirmed that they were, and that vacating that site did align with their overall strategy.
Councillor O'Brien, you have your hand raised? No, you don't. Anybody else wish to speak on, address Amanda on her report? No, that's finished. Thank you so much, Amanda. That's good of you to be here. Brings us to agenda item 14, which is Health Watch Hillingdon update. Long time for you to wait, Lynn. Now it's your go.
Thank you.
Please speak to the report.
Thank you, Councillor Palmer. I'll just pick up a few highlights from the report, if I may, because I'm sure you've all looked at it already. We did our Health Fest in the autumn. It all had to be online and virtual. We did have quite a low uptake actually from our young people, but we did hold 10 valuable virtual sessions, and I guess that's just the way things are going to be in future. But we have taken quite a lot of feedback from those sessions that we're going to be basing work with our young people on going forward. We continue to work very closely with the Trust and with healthcare partners. We're a member of HHCP. We've been working more recently on a survey about the vaccine, and we've already had 2,000 responses from our local population over a fairly short period of time, which are giving good indications about how people are feeling about that. We're still working very closely with the Hillingdon Hospital on a number of things. We've been raising concerns with the hospital that we're getting directly from the public, and also working some of those through HHCP. We are getting quite a lot of anxieties from the public about ophthalmology and orthopaedic appointments, which people seem to be struggling with. So we're working through with partners on how we might let the public know a little bit more information, and making sure really that these other things in a COVID world aren't lost, and that people's voices are still being heard. We've re-picked up the Loved Ones project of recently, which was a scheme that we worked closely with the Trust early on in the outbreak to try and make sure that the public had an access to information from the hospital about their loved ones in the absence of being able to actually visit the hospital. And that was quite an important piece of work. The metrics stopped being counted for some reason, but we're picking up again with their communications department about issues that we've had with regard to discharge, transport, etc., that do seem to be a problem at the moment within the organisation. We're involved as well with the new redevelopment of the hospital. Our Young Health Watch have worked with the redevelopment team on what's important for young people as well. So we've done focus groups with the hospital and our young people. And our intention in the new year is to use all the work that we did last year on care homes as a baseline, and really kind of having a look at what the baseline offering is, and how we can improve the situation within care homes from a Health Watch perspective, using that work as a baseline. I'm happy to take any questions that you might have or any comments.
Thank you. I mean, it shouldn't go without saying, but it probably does. We need to say thank you so much for your work during lockdown, and the innovative way that you've tried to respond to need. To me, it doesn't matter that there's not big figures about people that are engaging. It's the fact that you're out there and you're trying your best in difficult times, and it's very important that the voice of customers, that we continue to hear them. So thank you, Lynn, for all your work in that area. Do we have any questions for Lynn? Councillor O'Brien.
Thank you, Lynn, and thank you very much for the report. Well, first of all, I should say, I don't know if this is embarrassing or not, but I've never even heard of Health Fest 2020. So I would really welcome seeing some information about that, and maybe you can tell me where I can pick that up. And also, can we attend if we want to? Can we just bolt on and just see what one of the sessions is like as an observer? Because I would be really interested in seeing that. And I think that was my only question. Really, it's thanks. It's a really nice report. Thank you.
Thank you. So our Health Fest, we usually hold it over the summer holidays. The previous year it was a live event, and we had drop-in sessions for young people. It was very well attended. We had groups such as P3 were there and could actually go around, and the young people would engage. We had talks about drugs and alcohol and all of the things really that trouble young people. There was a lifestyle section where we had virtual monitoring and a whole raft of things really, healthy eating. It obviously links into the work that Kevin's doing on obesity. I can actually get you linked up with Kim Markham-Jones, who is our Young Health Watch coordinator, whose baby it is. She's known, as I'm sure you know, to the council. And it's open to anyone. I went, I learned stuff, even in my late years, about young people. And in fact, our sexual health survey that we did earlier in the year was born out of some of the misconceptions and work and information that we got from the Young Health Watch Health Fest the previous year. So we do pick up themes and needs, and we try and feed that into the work we do.
Thank you very much. I'd like to be linked into that too. It sounds a really, really good piece of work. Would anybody else like to comment on the report here? Okay, thank you very much, Lynn. That's really, really good. Thank you very much. Brings us on to agenda item 15, which is the board planner. Nikki, I think, are you speaking on this, or have I got that wrong?
I can speak on this, Chairman.
Thank you.
Okay, so it's the standard report, and on the back we've got the final date for the municipal year, which is the 2nd of March 2021 for the next meeting. That said, earlier on the agenda, consideration was given to having a workshop. So it may be that at some point in the new year we maybe look at moving that date so it's later in March, so that it does actually fit in with the workshop timings. In addition, during the course of the discussion today, there was consideration of the Better, or what was known as the Better Care Fund report, which is now known as the Integrated Performance Report. So I'll update the actual report title on the planner for March so that it reflects that, and also include an item so that we can have the feedback from the workshop on this agenda. So that's it, Chairman. Thank you.
Thank you very much. I think that brings us to the end of the public part of the meeting. So will the board members please stand by and remain on mute until Democratic Services has advised that the live broadcast has ended. Thank you to those members of the public watching on YouTube, and I hope you found it useful. Thank you very much.